All right, let's move on to question number 3. I'm a school-based therapist, and I'm looking for strategies I use with an 8-year-old student who has selective mutism but appears to also have oppositional behaviors, only speaking when motivated by specific rewards. Any tips here would be helpful.
So I think our listeners are going to probably predict what I might say here. I don't know anything about this 8-year-old other than some oppositional behaviors, has SM, and motivated by rewards. When we are giving school-based recommendations, accommodations, interventions for a child with SM and training, the therapist, we understand that child. Like, we do the selective mutism evaluation to determine the whys, what might be causing it, but what might be maintaining the mute behaviors, but also their baseline stages. It sounds like this oppositional behavior may be a push-pull battle, often with a child that doesn't understand themselves and almost like kind of acting defiant, but we need to read between the lines. I've never met an individual with SM that has true oppositional defiant behaviors regarding the SM. It's often a result of their inner frustration and their lack of understanding.
What does it mean when she mentions that she's only motivated by specific rewards? I mean, we're all incentivized by rewards. So like what is she getting at there? What are specific rewards
I
here?
can imagine that it might be quiet speech. It's not fully elaborate, initiative, expressive speech where she's now like, so that level of like lack of verbalization is not occurring. There's a reason this child isn't speaking. And then if the teacher says, well, I'll give you a sticker or I'll give you points if you're able to answer that question, that child may have like you said, a push to do it. So maybe if the teacher says, if the teacher says, what is the answer to this question? And the child is sitting there and the teacher says, well, is the answer, 5 plus 5 is 10 or 5 plus 5 is 11. And we're going to see how many points we can get. And the child's motivated to get points to get a reward. The child may write down 10, but might say 10. So has enough oomph to get a word out, enters verbal, but it's motivated by rewards. Whereas
Okay.
maybe the oppositional defiance comes in from their lack of confidence in their social communication skills to begin with. Is there any learning challenges with this child? Does she struggle with starting completing tasks? Is she distractible? What else may be going on? Does she have appropriate social skills? Does she have a connection to peers? Comfort, connection precedes communication. Is she disconnected from peers? Are they meeting her where she's at? Oppositional defiant behaviors itself surrounding the SM. I want to be clear with this. This is really, really important. Oppositional defiant disorder does not cause SM. A child with SM that is manifesting oppositional behaviors is usually a child that is being very misunderstood. There's something being missed, and this child is putting a defense up if that's related to SM. So I want all of our listeners to understand oppositional defiance does not cause SM at all. Never seen it, doesn't. But oppositional behaviors that exist means this child is feeling frustrated, misunderstood, has a defense mechanism, and we need to dive deeper into these whys. We need to
So
figure it out, and we have to see where they are on the bridge. Are they connected? Do they feel comfortable? Are they completing work on time? Academically, where are they? What is going on with this child?